Here now to discuss the impact the pandemic has had on education across the United States is Executive Vice President of the Robert Wood Johnson Foundation and former Chicago Public Health Commissioner, Dr. Julie Merida. Thank you for being with us.
Good morning.
Morning. Thanks for having me.
So when people hear that this Pfizer vaccine is so effective on, kids age 12 to 15, we're thinking, does this mean we're going to see schools full-blown open in the fall?
The vaccine efficacy gives us hope. I think we're in a hopeful phase right now where we have great vaccines that are available, that are working well and effective and protecting adults at this point. And there's trials that are going on to look at the vaccines and how effective and safe they are with children. And I'm hopeful that we'll actually have vaccines available so we can vaccinate our children. It's really important for our kids to be back in school right now, though, because I think we recognize how important it is for kids to be learning in person so they can really take advantage of all the opportunities that they have within the school system.
Teachers were moved up to get vaccinated, and yet some are still teaching from home. Is there a reason that they should not be in the classroom with the kids who are now e-learning from the classroom from their teacher who is at home?
So a month ago or so, the CDC issued some great guidance regarding how to safely reopen schools. We have a wealth of information that has been acquired since the pandemic began last year. And we know that there's certain things that have to be in place to allow children and teachers and staff to be in the school environment. And those kinds of things require masking, appropriate social distancing, appropriate ventilation. And some schools may need to have those kinds of systems ramped up and improved so that we can actually allow our kids to be back in those environments safely and our teachers to be safe as well. So there may be a need for hybrid learning for a while until we can make sure that all those systems are actually in place.
So are you saying that if teachers are vaccinated, that maybe less than ideal ventilation system in the school is going to make or break their health situation there?
Well, vaccination is highly effective. We know that. And so, and more studies are coming out to show exactly how effective they are, even in the real world outside of the clinical trial. So that's really important news. I think what I'm saying is that if everybody's not protected, there still are needs to have these other systems in place. So we can't let our guard down. I think we're having a sense of the increased cases occurring at this point. And it's something to keep our eye on, because just because 20%, 30% of our population has been vaccinated with at least one dose of the vaccine, there's still plenty of people who remain vulnerable. We need to wear our masks. We need to have appropriate ventilation. We need to maintain our social distancing as well.
All right, Dr. Julie Merida, we appreciate you joining us this morning.
Thank you.
Thank you, Doctor.